Okay, hi everyone. Thanks for joining us today. This is Sophia DeLaviore with RHSC. We're going to get started in just a minute. So Anita is going to walk us through this exciting new tool which just launched this morning. So most of you should have received our email with a link to the tool and a little tool. A really great opportunity to hear from Anita about why this need was identified for a tool like this, how they went about creating the tool, some of the and then we'll also include a brief live demo of the tool, and we'll send around the link so you can all create an account and give it a shot yourselves. So thanks. Go ahead, Anita.
Good morning, everyone, or good afternoon, depending on where you are today. And welcome to the RHTargetMarket tool launch. We're really excited that after 8 months of working with the wonderful team here at PATH IT, we've been able to complete this tool and bring together data from around the coalition into one place for everyone to be able to assess their market needs. So that new website that we're launching today is called RHTargetMarket.org, and many of you are already familiar with the coalition, but I'd like to give you a little bit of background about us. A unique organization that brings together all of the organizations that work on reproductive health supplies access for developing countries. We have partners that are from different parts of the supply chain, whether they're donors or civil society and different types of representatives from the private sector, including manufacturers. We also, within our manufacturing partnerships, have special groups. We have the Market Development Approaches Group, which encompasses all actors that work on the public and private sectors. And we also have a Generic Manufacturers Caucus, which brings together quality assured reproductive health generic manufacturers. So that's a little bit of background on the Reproductive Health Supplies Coalition. That's important because we basically built this on the premise of being a coalition. So when we started discussing the problems and issues faced by manufacturers, both in the MDA working group that I just mentioned, as well as in the Generic Manufacturers Caucus, we kept hearing that there are a lot of new products or newly quality assured products coming to market, but suppliers were unsure of how to determine the priorities of where to register these products. What would be the best strategy that would allow them to make a profit in those early countries, which would then allow them to grow and invest in more countries, thus bringing more access to reproductive health products across the developing countries. Well, we thought the first thing we should do is look at what data is available out there right now. Where of this data? Are they able to access it? And if not, can we put it into one easily accessible place for them? But we also recognize that there's limited time and ability for manufacturers to actually go in and assess and vet and ensure that this data is reliable data and that the data is also going to tell them something about what they should do. So what we thought was, why don't we create a platform where we have already cleaned and vet the data, put it into a single repository, and then layer on top of it an algorithm to help make those assessments. So our vision is to help with decision making. So we want to accelerate the market entry of products and help the manufacturers to get sales quickly. So where can they go to get the sales that they want in targeted markets? Now, although this was the primary aim of our tool, I would like to say that I have seen this tool be a benefit to several other partners within the coalition, whether it's donors, procurers, or others creating investment strategies about how to prioritize different countries. So just to give you a brief overview of what we're going to be looking at, we're going to be looking at how the tool allows suppliers to visualize the data, and we're going to be looking at indicators and attributes, which I'll show you exactly what those are. And once you select criteria that's important to you, either by selecting an indicator or an attribute, you'll be able to then make adjustments to that, tweak it, really customize it to make sure the tool is finding the countries that really meet your needs. And then our algorithm, which is a very easy, simple algorithm, will then send back a list of countries, and the countries will be ranked based on their score, which was determined by the criteria and how the countries were selected. So I'm going to walk you through how the tool does all of that. So before I get into that, a little bit of story about how this came about. You know, we really partnered with manufacturers in the development of this tool, not just to scope the need, but also to determine how the tool should look and what would be important to include in it. We started with a presentation to manufacturers in Copenhagen in the fall of 2014. This was at the WHO-UNFPA suppliers meeting that happens annually. And we got a lot of really great feedback at that meeting about the fact that this was needed and that this would be helpful only if it was fast and easy to use. I think nobody was looking for something that would be extremely cumbersome or upon exporting would require a lot more data cleaning or additional work. And so that was our aim, was to create something that was quick, fast, and easy to use. We then started our data collection work. So we reached out to partners across the coalition that we knew had country-specific market-relevant data or demographic data, and we tried to compile all of that data into the single repository. So we reached out to the World Bank, to USAID, to UNFPA, and others, and I'll show you that list of data in just a moment. In the spring of 2015, we actually did a presentation and got quite a lot of feedback on the development of the project from the Generic Manufacturers Caucus. And we then used that information to do the initial designs for the project. We did a project kickoff with IT in July of 2015, which was just last summer. And then later that month, we had our first core team meeting. And the core team was a few manufacturers, which I'd like to thank, Pfizer, Famicare Now Mylan, and also Pregna. They really helped us to look at the initial design and vet very carefully how we were looking at different aspects of the tool. And it really helped shape what we came up with for a demo, which we did at the Manufacturer and Procurer Summit in August. And then we actually had the test version available for a live demonstration in Oslo, which we presented at the Generic Manufacturers Caucus meeting. And then we plan to do, so this is a version 1 release, and it's obviously on this spring 2016. So we're doing the initial release now, but we expect to have several upgrades in here, and I'll mention some of those towards the end of this presentation. And we'll also be looking forward to your feedback as users on what enhancements you think would really make this very impactful for your work and to help us reach as many women with quality assured supplies as possible. So now I will talk a little bit about what's in the tool. So we mentioned this is built off of a database. That data collected from across our coalition partners, and we organized it into what we call indicators and attributes. So when you're in the tool, you'll see this bar on the left-hand side, which has a lot of gray items, population, priority country designation, and others. And we call these the indicators. And then when you click on the arrow, you can see within each of these there are attributes that can also be assessed. So under population, which is the example here, you'll see that we have two different types of population attributes. You can either look at the percent of urban population, or you can look at the total population. So depending on what's important for you for your assessment, you can select either of those. So that's just a little bit about the terminology in the tool. I'll now take you through a list of the indicators that we have in the tool and the data sources that they've come from. So the data indicators that we've included right now are listed here, and they're grouped on these slides by category. So we have market size, And we have 4 databases that correlate to market size. You can see those. We also have some regulatory requirements, and I'd like to thank FHI 360, in particular Ida Cancel, for helping provide that information to us. That's, I think, the most difficult information that we find to capture is regulatory requirements. Part of that is the environment for regulatory changes it's constantly happening. So we know is a requirement today may or may not be a requirement tomorrow. And therefore, this data is definitely limited, but we're always looking for more of it. If you guys know of any new suppliers of this data who can provide us with this information, that would be really helpful to improve the tool. We also have demographic indicators and some miscellaneous indicators. So as you can see, our data providers span several well-known and reliable data sources from the World Bank, Population Reference Bureau, USAID, UNFPA, Track 20. And I bring us back to this page to remind us that the website that we'll be looking at is RHTargetMarket.org. And although this is a tool for decision making, I just wanted to say the obvious, which is that no tool that we create will ever tell us always the right answer. What we mean for this tool to do is to help us shape our thinking and provide us with information that can start a conversation. So what this tool returns can be exported and then further assessed. It can be exported and shared with others who might have different views on what the data results are. It can be exported and you can determine that there are things that you want to continue to include or refine or change, but that really it's about what information can it give you to support decision making. It's not meant to just tell you the answer. So it's part of a process. And that process from a manufacturing point of view would be, or even from a strategic point of view if you're an NGO, is I'm thinking about which countries I want to prioritize. What are the priorities that are most important for me? And that's step one. I would say before you even enter into the tool, you want to have a good sense of what those priorities are and what type of an assessment you're trying to get to. So the basic steps to using the tool are, once you understand what those priorities are, they're to choose the indicators to be included in the analysis. Then you'll set the thresholds for the preferred values, and then you'll run the analysis. So I'll take you through what that looks like. So once you're in the tool, you'll be able to see that you'll choose your attributes from the left. As you can see here, we have a list of the indicators: climatic zone, contraceptive prevalence rate, and what you'll do is you'll expand those and move those selections over to the right. When you're looking at those selections, you may want more information about them. To access more information about what those indicators and attributes are, you can simply hover over that information button, and it will bring up a description of that attribute, the number of countries for which there's data in that database, either of a non-null or a non-zero value, the date that data was imported into the tool, the reporting period for the data. So that's either the date this was published or the date that this data was collected by the original data source. And then we have the selections. So once you've started moving things over, if you click Add, they move over to the right, and they'll become part of your selections. Once they're in your selections, you'll see that there are settings buttons on the right, and that will allow us to set the thresholds. So when we're looking at thresholds, we're able to see the data, visualize it, and then control exactly how we want to assess the data. What are the countries here that are of the highest priority? What are of the lowest priority for us in particular, for our question? And to do this, we would look at this table. So the data for all of the quantitative indicators, such as MCPR, are brought into the tool and organized by quintile. So there are 5 sets, each one with 20% of the countries. You can see the ranges start with here with 0.022 in set 1. And the reason that value is gray is because that is the value associated with the country that has the lowest value in that data set. So you can't really go below 0.022. So each range is from the lower bound to the next bound of the bound of the next set. So you can see set 1 will be from 0.022 to just below 0.142, so 0.141. And if you're not interested in looking at quintiles and you would rather be looking at different types of sets, I'll show you how you can exclude different sets or how you can change the values in these sets. So I'll do that in the live demo just after this. But you would save your settings and then go back to set the thresholds for other products. For example, you might want to, for other indicators, for example, you might want to set some of the qualitative prioritization. So for example, if you want to register your product in only English-speaking countries where English packaging is accepted, then you may want to go in and exclude or deprioritize French countries from your analysis. In order to do that, the default would be to, if you clicked French, to have them prioritized. But you could also go in and deprioritize them by coming in here and clicking on No. And I'll show you how to do that as well within the tool. And then you'll simply hit the Run Assessment button, and it will return the results. And from here, you'll see that we have several columns. We have the indicators and attributes on the left, or across the top, and then we have the countries on the left, and then we have the data associated with that database. And you'll see that you can either go back and edit the assessment. You can say, oh, now that I see this list, I see I might want to add in a particular other indicator or attribute. And then when you look at the results, you can see which countries came out on top. You can say, oh, wait, Egypt actually showed up here. I want to deprioritize some of those higher income countries. Maybe I'll go back and select region and deprioritize, or select income level and deprioritize those. And so there are ways to really tailor your assessment to be able to get to a list of countries that make sense to you. So now I'm going to jump into a live demo. I'm going to show you what it looks like when we go into the tool. So this is RHTargetMarket.org. And when you come to this page, I encourage you to just take a look at it and scroll down. You can see why would you want to use this tool, what are some of the easy steps to get there, and who's been using it so far. And another key thing to note on this page is that we'll be showing you what are the data sources and then what was the last updated date. So here we'll be able to tell you if we add in another data source in May, you'll be able to see this increase 16, 17, 18, 19, 20 databases. And then the date will also change. It'll change from March to May. That's a good way to know whether, since the last time you've run an assessment, if there's something new. So then you'll click here and open the tool. Once you're inside the tool, you can create a new account or log in. So here, I will log out so you can see what that looks like. You can create an account on this page, populate this information, take a look at our terms of use, accept and register. Or you can sign in. And then you'll come to this page which shows you all of the assessments that you've run in the past. You can either select a new assessment and create a new one, such as this. where you can put in the name, a description, and the product name, and then save, and it will show up on your assessments list. Or in this case, we'll just go to the webinar assessment that I had previously created. So once you're in this assessment, you can do several things. You can expand so that you can scroll through and look at what the criteria is that's available. If you want to print it out and look at it in detail, you can click on Attribute Details and download that. If you want to take the question that you already had in your mind and run a very specific report on that, you can do that as well. So let's say that I wanted to look at high population countries with high MCPR rates. And specifically, I want to target FP 2020 countries. Well, I would add MCPR. I would then go to population, and let's say I couldn't find it right away. I could just type in population here and hit search, and it would pull up what I'm looking for. And then I'm also looking for priority country designation. So this is one which will help you pick out FP 2020 focus countries, Ouagadougou countries, UNFPA countries, or USAID countries as a priority. So if, in particular, you know that there's a procurer that wants to buy your product, you can help prioritize those countries. So here I'm going to prioritize the FP 2020 focus countries. If we wanted to, we could go into the settings and look at the different bounds associated with this. So these are the quintiles. And the default is that a rank of 1 is the highest priority. So set 5, which has the highest MCPR percentages, is going to receive the highest priority. Let's say I want to exclude some values, or an entire set, and give it no points. I will just click 0 and 0 these out. So I'm going to give these values 0. And then I will update the graph to make sure that's looking good. And what you will note is that those countries then turn to gray. Okay, so now I'm going to save my settings, and then I'll show you what it looks like for our FP 2020 focus countries. So I want to confirm that these countries are the countries that I'm looking for. And indeed, this is the list of the 69 FP 2020 countries. So that's exactly what I'm looking for. It already is defaulted to yes. So I can either hit cancel or save settings. And here I'll just save settings, and it goes back to this page. And now I'm going to run my assessment. You can see we have the results here. And on this side, we have the scores. So these are the countries that received the highest scores based on the criteria that we input. And it can help you then refine your thinking about what you want to include. You can also export this data and then work on it within Excel as well. So that is the live demo, but now I'll take us back to the presentation, and I will show you what's coming next for this tool. So what's next? Well, this tool can quickly help you assess data sets from recognized coalition partners. It will help you see which countries can easily meet your criteria with those indicators and attributes that you specify. It can help you identify countries which may need more support. So this isn't always about which countries best meet a certain criteria of always being the highest of a certain value or always being, but you can also look at, okay, which countries are really not receiving a full method mix of products? Which countries do we identify where they may need more training support, where they might need other kinds of conversations to happen and strategically occur to help improve access to contraceptives? So we can identify those using this tool as well. We can also export and share these assessments with colleagues. have those conversations between different groups within the coalition, depending on what the results are. And then we can identify gaps in available market data. I think that's something that's come out very clearly in the development of this tool, is that not all of the data that everybody had specified as most important or most desired is actually captured at this time in a clean database. And so there's a lot of work to do in the community, and this will help us as a community identify those larger data gaps. And then at any time that there is new data, this tool will help us by taking those new data sets in dynamically and updating the indicators and attributes that are available for us to choose from. So this was version 1. What's next is version 2. So here I've briefly put a couple of things that we think will come in version 2, but we're also looking for feedback from you of what would be a priority. So we'll definitely be grouping the indicators and collapsing them a bit. So overall, they'll look a lot more organized. We'll also filter the assessment results by attribute, allow you to do that, and then we'll include year-over-year reports, and then those exports will be able to be used in the data visualization tools. So we will include new data sets as well. Some of them we know are coming, and others we're hoping to get access to. Some that we know are coming are the Global Market Visibility Project that's put together by CHI, and that one we hope to have in July, which will update the data to 2014 and 2015. The UNFPA Procurement Support Report for 2014 is going to be updated and published publicly soon, and we aim to have the WHO collaborative procedure countries loaded into the tool next as well. So if you'd like to become a data provider and you have more data for us, don't hesitate to email us, rhtargetmarket@rhsupplies.org, or if you're using the tool and you have feedback for us, you can also send your feedback directly to that email address. And this is the same email address you'll use if you run into any issues within the tool. Of course, this is version 1. We expect that if you have any questions about how to use it, how to log in, how to access your assessments, that you can just just email us, and you can pick up the phone and call me anytime. I think I know many of you. So we welcome you to share with us your experiences. If you're using the tool and you find it to be very valuable to you, we would love to hear from you. We would love to be able to share those stories with more people. Our communications team would be happy to do a blog posting or a short story about your use of the tool. So definitely let us know how it's going and how you're using the tool. And I would be happy to take any questions that you may have right off the bat. If you'd like, you could also hop over to the website and create a login right now, and then try it out during the Q&A session so that I can take questions live while you're in the tool.